I'm Nerida McDonald and this is the weekly update for Walker Street Doctors, North Sydney for Monday the 31st of May 2021. Last week, ATAGI, the Australian Technical Advisory Group on Immunisation, and the Thrombosis and Haemostasis Society of Australia and New Zealand published a joint statement on thrombosis with thrombocytopenia syndrome and the use of COVID-19 vaccine AstraZeneca. A brief summary of that position statement is that the risk of TTS is not likely to be increased with people with the following conditions, and people in these groups can receive the vaccine. People with a history of blood clots in typical sites, people with an increased clotting tendency, including factor V Leiden and antithrombin 3, people with a family history of clots, people with a history of ischemic heart disease or stroke, history of current or past thrombocytopenia, that is a low platelet count, those receiving anticoagulation therapy, reiterating that all of the above groups can receive the AstraZeneca vaccine safely. The list of conditions for which the Pfizer vaccine is preferred has been expanded to also include the antiphospholipid syndrome with thrombosis, or a past history of idiopathic splanchnic vein thrombosis, that is specifically clotting without known cause in the mesenteric, portal or splenic veins. TTS can be treated effectively and is best treated in hospital. Red flag symptoms can include severe persistent headache that's different to a usual headache and doesn't settle with paracetamol or ibuprofen. They can also include other neurological symptoms, persistent abdominal pain, leg or chest pain, or a petechial rash, that is a rash with a pinpoint bruising look about it. Walker Street Doctors continues to provide vaccination clinics all day on Thursdays and on Friday afternoons. We do ask that wherever possible, all other patients make telehealth appointments on these days to minimise crowding in the surgery. We'll be finishing our very last COVID vaccine number 1 clinic on Friday the 2nd of July, which will be followed the next week with our first COVID number 2 clinic, starting and continuing until the 24th of September. For all of our patients who've decided to wait to be vaccinated until after that time, they can use one of the hubs or through the respiratory clinics. We continue to wear masks in our practice and continue to sign in and out through the Service New South Wales app. We'd also like to take the opportunity to advise all of our patients that the very first step when you or your child are experiencing any respiratory symptoms whatsoever is to get a COVID test before doing anything else. I hope this update has been helpful.